Welcome to OB-GYN Chats. We always love giving you free consultation where you are allowed to come into the world to freely express your opinions, and we have those difficult conversations. Today, it's quite controversial, if you want to say so. We're discussing about preserving eggs, and to best discuss about it, we're joined by the expert, Dr. David EMVULA. Welcome.
Good day, Ilke. Thank you for having me.
Lovely. So
Yes.
when we speak about preserving the eggs, do you think that Namibians are open to this, number one?
Yes, I think the world is changing and people are becoming more aware, and the information is also widely accessible, especially on the internet platforms. So yes, and we have had a couple of patients that
Okay.
came to ask us about this. Yes,
Yeah.
so I think
And you've performed the surgery too, or
more-
you've done it?
Yes, not at our practice currently,
Okay.
but yes, I'm exposed to it.
Yeah.
Being in the fertility training space. Yes.
Oh, wow. With so much technology and, the ethical aspect, is it okay? Is it right to do so? We're going to get that to the way end.
Yes.
But for those that have no idea what we're talking about, preserving the eggs, let's place it into context, Doc.
Yes, preserving the eggs, it's not only the eggs, by the way, we can also preserve sperm.
Okay.
Yes, so
Really?
it is both for
Wow.
males and females, or we can also preserve the tissue. So to put it in context, what we're trying to say by preserving tissue, eggs, sperm, we literally speak that about to have these eggs or a sperm or a tissue, which is a testicular tissue or an ovarian tissue, being kept away in a way that it can be used later in life. So literally it means we take your eggs or the sperm or part of the ovary or the testicle, and then it is preserved in such a way that it is safe to be used in the later stages. So that is simply what it means. Yes.
So one step backwards, Doc. And again, you've been exposed to this, which is good. What are the most common reasons on why couples decide to do this? What are some of the top reasons?
So this topic, this context of preserving tissue, eggs, and sperm actually came. It is more, you can call it in an incident way, because it was developed to help patients, especially in the what we call oncofertility sector or field, where we have young patients that are unfortunate to have cancer conditions. And we know that as part of the treatment with cancer conditions, you either require surgery, and surgery may remove the organs that are involved in the reproduction, such as the ovaries, such as the uterus. Or if that is not the case, even the medications that we use in the treatment of cancer is associated with toxic being, or other words, they are toxic to these organs, which is the ovary or the testis. So that's how it developed, or it came. So it was found that, so how to help these people is that it was experimented to see if it can be used, where you take now these eggs, or you take the sperm or part of the ovary or part of the testis, and try it later to be used, and it was found to be a success. And eventually then that is how this field developed. And then it now became adopted to other conditions, such as now medical conditions, especially in the field of female reproductive medicine, a condition known as endometriosis. It has an impact on the ovary, and it has also been studied. So that is one of the indications. The other important indication includes diminished ovarian reserve related to egg fertility. We know that women have a narrow reproductive window compared to men, meaning that from your mid-30s, we know there is what we call a reduce in your reproductive ability, specifically related to the egg quantity, number one, meaning that your egg continue to decrease every day. As you reach your mid-30s, your egg quantity is almost depleted. But not only that, the quality is affected. That also, the quantity, it also includes the quality, meaning that if you have someone who is conceiving a baby at 20 years old compared to someone conceiving a baby at 39, 38 years old, those two eggs are not of the same quality. The other one is older. And what does it mean to have an older egg? An older egg means that you are at risk of having a baby with, number one, chromosomal abnormality. And if you have chromosomal abnormality, there is a risk of miscarriage. and there's a risk of then giving a baby with other anomalies. So that is literally what it means. And so the success of the pregnancy also depends on the age, on the egg quality. We don't see that much for men, but specifically for the age-related fertility is one of the indications also that can be used.
Yeah.
And the other area is also in the field of LGBTQ community as well.
Yeah.
There has also been a lot of use for this method of egg tissue, egg of sperm or testicular freezing. Yes.
The world is changing, Doc.
Yes, indeed.
And many times you've mentioned the let's say the history background on the health on making these decisions. Is there some way, somehow, parameters, only certain people can be given permission to do so, seeing the sensitivity around the freezing of the eggs? And again, may I add, with the celebrities, some people do bogus things by freezing their eggs because they want to have children after they have passed away, and these are really bogus reasons.
Yes, indeed. So there is actually a hot topic in the reproductive space, is what we call social egg freezing, or you can call it elective egg freezing. Literally, this is when a woman just wakes up and say, look, I'm not ready to have a baby today, or in the next 2-3 years, or in the near future, for many varied reasons, such as which can be professional, where you want to do career advancement, can be educational, you want to perceive a certain degree, or even you don't find a suitable partner to have a baby at that time, which can also be personal, or it can be for many other reasons. But or you just realize that, look, I'm getting older and I'm not ready to have a baby, let me rather preserve. So it is happening now that we are seeing more and more women coming into what we call social freezing, and it is also now globally accepted as a form of indication to go through the process of this fertility preservation.
So the medical board approves it for the social reasons, personal reasons.
You can do that, yes.
So what are the success rates, doctor, and like you said before, the age, all the factors play a role. So how do you get a successful rate at this?
So again, the success rate, the first one is always related to the age. So the point, what I'm trying to say, the age, is that if you preserve your eggs, especially if you give you freeze your eggs at a younger age, compared to freezing your eggs at an older age, already that, because the quality of the egg depends on the age. So again, so the age is a big factor. And then other factors over the years, obviously this field has been evolving, and there has been an improvement in the biotechnology on how to preserve the eggs and store them. Because remember that I think I'll highlight about the process is that you need to store these eggs in a frozen environment. Specifically, we use liquid nitrogen to store them, and they also then, once they are stored, they also now need to go through another process to re-freeze them before they can be used or to be fertilized. Remember, this is an egg, and then once you now find a suitable partner, say you freeze your eggs at 20 years old, you don't have a suitable partner at that time, and then once you find a suitable partner, you can then refreeze the eggs, which a process is called thawing in the reproductive field, and then that allows you now to put the sperm and the egg together to form an embryo, which will then be transferred.
So you do this in a lab? I'm trying to imagine.
Yes, these are lab-based. That's why we're saying it's not something that is done.
Right.
It's done. It's a lab-based. Even the eggs are not stored at the. It's not something that you store in our fridge in the practice.
Yes.
So all this is done at the. It's a lab. So it
this
is
a
a
new
fertility.
concept.
Yes, it's done at the lab. So in the labs, you find that we have this liquid nitrogen storage that are always in the labs. Okay. And there is also, that's why it's a little bit expensive process to do it, but storage is about, it's not very expensive. It's about 3 to, depending on the lab cost, but it's about 3 to, it's probably less than 10,000 per year. So you need to pay a storage fee for annually to have your eggs or your other sperm stored for whatever reason.
Okay.
Yes.
So it is a costly exercise for those elite. It looks like the bracket range that want to go for this process as well.
Yes.
For those that don't have a success rate, ethically, how do you counsel, how do you guide? Maybe you haven't reached that point yet, Doc, but there is a percentage chance that it won't be successful.
Yes, like I said, so the process is that we get the eggs. In other words, we give you drugs. The process involves you giving you drugs to stimulate your ovaries, And then once we stimulate the ovaries, we see how your ovary responds to the treatment. And then we do what we call oocyte retrieval, meaning that we get your eggs. And then that also depends on your age. Specifically, you find that, or even conditions, for example, patients that are older, patients that have other medical conditions, specifically endometriosis, may not give us the number of the eggs that we would want. So you might not get enough eggs. We want at least to have at least 10 to 15 eggs, but you find that in some women you don't get that. So already that is already can be a factor to success, because if you only freeze about say 6 or 7, it doesn't mean that all these 7 will be surviving the freezing process, will also be surviving the thawing process, meaning that refreezing, and then including the other next step, which will be meaning that even if you have these eggs available, it doesn't mean that all these eggs will fertilize. So the success rate it all varies based on all these multiple factors, but it is reported to be about 40 to 70%, and we are seeing more improvement with an improvement in the biotechnology, especially with the freezing technology and also the thawing technology. That all plays a role. But also the other thing is that what type of eggs that we freeze in the first place. Are they good quality eggs that we see in a young patient, or they were already those poor quality eggs that we see in the older patients? So it is variable depending on all these multiple factors.
Under 50% chance rate, is that what you said?
So yes, so what you're trying to say, it doesn't, freezing eggs or any day does not guarantee pregnancy. I think that one also needs to understand that, and it is meant to be an assisted reproductive technology, meaning that it should be a process that should be assisting you when you need it. In other words, it's more like there are patients that we may request to have what we call egg donor. It's more, instead of getting an egg donor, you can be it's more like a self-donor, where you rather have this preserved in case you need it, then you may use it instead of getting someone else's gametes to use. Yes.
Interesting topic. I know there are so many questions that will probably be on the feed right now. Feel free to contribute as well. While we wrap up, Doc, for those considering to do this exercise, what are the advantages? What are the disadvantages? And would you promote it? Would you not promote it? Just the best advice as a gynecologist.
Yes, we as a practice are advancing to become into a fertility clinic. So in the near future, we'll be getting there. So yes, we are encouraging patients to come and inquire if they meet that criteria. It's not to say that we now advocating that everyone must come for fertility, for egg freezing or fertility preservation, but specifically for those patients that have conditions such as, for example, endometriosis. One needs to have a discussion with those patients that maybe they should really consider to have those egg freezing. Patients that have been through the cancer treatment, they actually need maybe to come and seek a gynecological expert opinion, because we know that, as I highlighted earlier, these drugs they are toxic to the ovaries. They actually affect the quantity, meaning that if you take someone who has been exposed to chemotherapy, for example, that we use in cancer treatment, and someone who is not of the same age, you might find that the quantity of the eggs that they have, that we can test through doing an ultrasound or other tests, in blood tests such as anti-Mullerian hormone, we can predict that your quantity is low. Then those patients will benefit from egg freezing if they are not yet ready to have children. Maybe they want to delay. And even those patients that are willing, they want to delay childbearing for personal reasons, career advancement, not having a suitable candidate at the time, but they are already reaching their late 30s, early 40s. Yes, those are so it's all individualized and based on those factors, and there is definitely a need for them, yes, to consider it, yes.
Very interesting. I was going to say, for all those working moms.
Just to add, the point is that it is better to freeze eggs.
Yes.
Rather than trying to seek fertility treatment when you are older. So if you are 43 and you are seeking fertility treatment, the success rate there is even very poor.
Yeah.
And that is why we really encourage them that I think it's better to consider that early on and then rather coming later.
Eye-opening.
Yes.
As I was saying, for all those, we have so many independent women now, Doc. They're just like doing their doctorates and their PhDs. They gotta work. So maybe it's a good solution for them.
It is, most definitely.
But don't neglect their husbands, please.
It is most definitely. Yes, it really does. And it does wonders in terms of course, what we see is that as you grow older, the success rate when you're seeking now fertility treatment is very, very poor.
Yeah.
And from the financial perspective, it is cost effective to freeze eggs at a younger, earlier than coming later to see. Even the drugs, if you are giving you medications, older patients, you might need a higher dose, meaning that you may even spend more. So yeah, all these factors, it is a better option.
Doc, maybe we should have a part 2.
Yes.
Thank you very much.
Cheers. Yes,
and remember,
good,
you can
good.
always consult with Dr. EMVULA. That's David and Simon at OB-GYN. Thank you for always joining us on OB-GYN Chats. And feel free, if you have a topic in mind, suggest it, and we will have it on the next episode.
Yes.
Thank you.
Thanks. Okay.